So, one thing I always try to reassure patients about in regards to crowns is it's absolutely different from an adult crown. Adult crowns are, multiple days, sometimes hours long. Pediatric dental crowns are very quick, something that's done in usually about 15 minutes or less, and everything is completed on the first visit. So, it's a totally different procedure than an adult crown and much easier and longer lasting in a lot of cases, especially if it's a larger cavity. So, one of the reasons for kids who have larger cavities, I always recommend a crown over a large filling. Large fillings look beautiful, but they fracture. And when that fracture happens, the kids are in discomfort and higher risk for infection can happen. So, in those cases, you end up having to remove a tooth, multiple procedures long, and things can get more complicated. So, whenever I plan treatment for a child, I always look at the long term picture. I look at, what's going to be the best for the child and prevent multiple recurring appointments. So when we see a large cavity, sometimes the crown is way better than doing a big filling. So, we work with all kinds of patients and all kinds of dental scenarios, but I've treated kids with some rare developmental disorders, including ectodermal dysplasia, which is a situation where kids have almost all their baby teeth with that are malformed. So, for instance, the front teeth, instead of looking like a square, can look like a triangle. And for those kids, they have pretty significant cosmetic and aesthetic concerns, even at a young age, even 4 or 5 years old. So, putting a crown on someone like that and making them feel more comfortable, more confident going to kindergarten is really satisfying, rewarding, and one of the simplest, best things I can do as a pediatric dentist. So for any of the crowns that need to go on the front teeth because of, the location and the size of the cavity, they're all white. So all the ones we do in the front are white. They're almost the exact same color as a regular tooth, and we shape it to look like a natural tooth. So it's pretty unlikely that normal individual will be able to point one out. Only a dentist and maybe a parent who knew what it looked like before is the one who can tell the difference there. One thing I always try to explain to parents, especially we have a lot of engineers in the area, is they do have a good understanding of force and, the material strength and things that can wear down, right? So I always try to remind parents that, if we have a large filling or cavity on multiple sides of the tooth, then putting something around the whole tooth is going to be a lot more solid, stable, and create less problems in the long term for children. So any engineer understands the Farrell effect, and they have a pretty good idea and understanding about the strength of a crown versus a larger filling in those situations. So, if a child has multiple large cavities and need a few crowns, we make the decision about how we do the treatment based off of a number of different factors. But number one is the child's age and behavior. Because if we have a very young child, under 4, that has a lot of extensive work to do, it's very unlikely that they're going to sit still for 30 minutes to an hour with their mouth open for multiple sides of work. In those cases, we usually will recommend some other type of sedation just so the work is done comfortably for the child and done with the best quality. So if we have a moving child, that obviously hinders the quality of the work. So that's the second, decision making factor for me is if the child is a wiggly child or moving a lot, sometimes we make a decision to do it under sedation versus separate appointments under laughing gas.